Here is the question. Please, 2 slides. Once you've read this one, you can say next, and I'll move it to the next one.
Okay, done.
Yes. Next.
Okay.
Right. So if you have read and understood, considering it communication skills station, kindly please begin. Begin, please.
Okay. Hello, I am Dr. X1 of Surgical Doctor here. I am calling for cardiothoracic surgeon about widening mediastinum. Can you please confirm that I'm calling for cardiothoracic surgeon?
Yes, doc. Can you summarize your case?
Okay, hello, sir. I have a patient 21 years old, complaint of RTA. Patient Glasgow Coma Scale, it is 14. Patient also increase of the heart rate, blood pressure 180. Hemoglobin of the patient is decreased for 8. And ABG showing metabolic acidosis. X-ray done for the patient showing widening mediastinum. Also the patient absent of the psoas shadow, left femur fracture. We started 4 liters of crystalloid and 6 units of blood standby. And chest drain for right chest, it is done.
So what do you do for cervical spine?
I will do heart collar, sandbag, and tape by triple immobilization.
So was it done?
I will check for that and back review, sir.
Okay. So what you have done for the fracture?
We will fix the fracture by Thomas splint.
Okay. So what you do for blood pressure?
So the patient started by 4 liters of crystalloid and 6 units of the blood. It is standby. We will start blood transfusion, and we should not let the blood pressure rise more to fear of increase the hemorrhage.
Okay.
We will keep systolic blood
So-
pressure below 100.
So why you think the
Mm.
blood pressure is low and the heart rate is high?
We think that the patient with hypovolemic shock, and also maybe the patient with obstructive obstructive shock.
Okay. So why you think the patient is having acidosis?
Yes, the patient with metabolic acidosis.
Why? Why you think?
I think this is due to hypovolemic shock.
And
Only.
left thigh
Or
swell,
obstructive shock. Or obstructive shock.
compartment syndrome,
Compartment syndrome, yes, because the patient with
And?
fracture of the femur.
And
and
is a diabetic patient?
And yeah, maybe
diabetic
metabolic
ketoacidosis.
ketoacidosis.
Yes.
Okay.
Mhm.
So what about the abdomen? What do you think? Why this SWAS sign, SWAS shadow is?
So absence of the soil shadow maybe indicate of the presence of retroperitoneal collection, and this maybe lead to laparotomy, except-lateral laparotomy.
Okay. So what do you do to test that one? To confirm your diagnosis?
So to confirm this patient for retroperitoneal collection, I ask for that.
You ask
Hello?
for? Yes, I'm
Are-
saying, as you
Yeah.
said, the SWAS shadow is blunt, so you thought could be an intra-abdominal collection or maybe a retroperitoneal
Yeah,
collection.
you need to
What do you
exploratomy
do?
laparotomy. So patient unstable, we need
What
exploratomy laparotomy.
investigation you will do?
Maybe the patient need for CT, but not now, because it's
Yes,
unstable.
as the
The
patient
patient
is
with
hemodynamically unstable, so you
Yeah.
have to do it first.
fast scan, yeah.
Yes. So, what are the abnormality in the blood?
The patient with decrease of the hemoglobin, and also the patient have metabolic acidosis.
Okay. So, why you want to transfer the patient?
This patient with widening mediastinum, so and this is indicate of the large vessel ruptures as aortic rupture or cardiac tamponade.
Yes, but you put a tube on the chest,
Yeah, we put a tube in the chest.
so it's not draining.
Is not what?
Is it draining?
I'm really I will check for that and talk to you for if there is training or no and the amount of training.
Okay. So, as you inserted the tube, why you want to send the patient?
Because the patient it is now hemodynamic unstable, decreases the hemoglobin, and blood pressure start to decrease, and we refer to the patient with hypovolemic shock. For that, we send it to
So the
repair
answer will be.
to repair the.
So the answer will be the chest tube will drain from the pleural cavity, not from the mediastinum.
Mhm.
Okay, so who will you accompany for this patient? You want
I
to
will
come
come
alone?
with one of our anesthesia colleague for
Okay,
intubation of the
anesthesia
needles.
or ITU colleagues. Okay.
Mhm.
Okay, thank you.
Thank you, sir. Or you want me to summarize the patient?
Okay, you can summarize the recommendation and your case.
Okay, so we will support the cervical about this patient RTA with widening mediastinum. We will support the cervical spine by a triple immobilization. Also, will fix immobilization of the left femur fracture by Thomas splint. I will check for the drain and start to refer the patient to you with one of anesthesia colleague for maybe needed for intubation.
Okay.
Good.
Okay, sir. I will call you with just when I'm right.
Okay,
Yeah.
thank you.
Thank you. Nice.